Have you taken the IELTS multiple times without success? Are you 2, 1, or even just half a band away from what the NMC or GMC require in order to give you your PIN or license to practice? Then stop, take a breath, and let us help. You see, here at IELTS Medical, we've given doctors and nurses the tools they need to pass the academic version of the IELTS exam as efficiently as possible. Whether you've reached above 7.0 in 3 sub-tests, but can't seem to crack IELTS writing, whether it's IELTS reading that's the thorn in your side, it's okay, we're here for you.
Guys, I just saw this headline and I thought I should share. Honestly, English language requirements, IELTS or OET requirements for care workers might be increased after this. Dementia sufferer, 91, died after becoming trapped in stair lifts when foreign care staff could not understand the difference between breathing and bleeding. What is this all about? Let's find out. Welcome once again to my channel, guys. On this channel, I talk about nursing, I talk about migration, I talk about opportunities for people to relocate abroad, and I talk about nursing and life in the UK as an immigrant in general. So if these are topics that interest you, please do consider subscribing. There was a conversation in one of the WhatsApp groups that I joined where people were saying that the English language requirements for care workers might be increased after this warning. And it's possible. It's possible. As for the UK, it takes them just a second to make serious decisions. So it's highly possible. Now, let's look at what happened, what this is all about. So I'm going to read from Mail Online News, okay? I'm going to read verbatim, and I'm going to leave the link in the description so you can also read for yourself. So it says, a senior coroner has issued a warning about the inability of foreign staff to speak English after hearing how carers looking after an elderly woman who died did not know the difference between bleeding and breathing. So this poor lady who died, unfortunately, is called Barbara Raimel, right? And then she was 91. She was a dementia resident, and she became trapped in a mechanical stair lift after a fall at the care home she lived at, with staff being unable to free her an inquest head, right? So the reports found that in the 999 call, they called 999, her 2 carers, one is Romanian and then the other one is Indian, were unable to explain to the emergency services what had happened to her. So these Romanian and an Indian person called the 999 to report that probably she's been stuck on the mechanical, lifts, blah, 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 she needs help, right? And then they said they did not understand the difference between their patients being alive or being alert. So their lack of English severely hampered the call handler's response and made a meaningful assessment of her condition virtually impossible, the coroner said. So following the call, Mrs. Raimel's case was classified as serious rather than requiring an immediate response. So when paramedics did arrive at the care home, she was dead. So you know when you call the paramedics, okay, they don't just show up immediately. They ask you what's happening and then they assess it, or let me say they triage it. So based on how urgent you need medical attention, then they rush to you. So I've had cases where, let's say the person had a fall, did not hit the head. We are probably only worried because the person is on a blood thinner, right? And all vitals are okay. And we just need the person cross-checked in the hospital, maybe CT scan, blah, blah, blah. And the paramedics can show up the next day, maybe after 8 hours, 12 hours, right? And I've also had cases where, let's say somebody falls and then let's say blood pressure drops, the person is not fully conscious, and then the person is probably bleeding, has a wound on the head, and then you call them, and before you cut the call, they are ringing the doorbell. Okay, so usually they triage to see who needs help most, right? So apparently this woman actually needed immediate response, but because the carers who phoned were not able to really communicate how bad the situation was to the paramedics, they put the lady's case there as serious rather than immediate response, okay? So they came way later, and when they came, the woman had died. And they are blaming the people's inability to speak English or understand English correctly. If this was an African, God, the case would have been worse. Senior coroner for Somerset, Samantha Marsh, has now written to the Home Office. Now, this is where it gets very serious. This person has now written to the Home Office and the Helen Watley Minister for Health and Social Care to warn of the potential of future deaths if English standards are not addressed. In a highly critical report, she said the current test for foreign health staff is wholly insufficient. So let's look at where we came from where now health and nurses, English, whatever was reduced, and now this incident has happened. And now they're going to take critical, because this is a death, and this is serious, you know, this is very serious. They're going to take a whole look at this, and she has written to the Home Office. God. So in a highly critical report, she said the current test for foreign health staff is wholly insufficient. The Taunton inquest heard Miss Ramel's death occurred on her first day as a resident. Oh, her very first day. Oh, God. The dementia sufferer arrived at the home on August 8th, 2022 from hospital, having suffered a fall in the community and was known to be frail with blurred vision and at high risk of falling. She relied on others to keep her safe, the coroner said. She was the only resident in a bedroom on the first floor but was incapable of using the stairs or the stair lift on her own. Right. Mrs. Marsh said in her report, on the evening of the 8th of August 2022, two carers were on duty, neither of whom were native English-speaking nationals. One was Romanian and the other was Indian. At 7:27 p.m., one of the carers called 999 to request an ambulance. It was clear on the evidence that Barbara had been left unattended on the mechanical chair for around 5 minutes. This was clearly contrary to the rules and procedures of the care home, right? During those 5 minutes, she has left the seat of the mechanically operated stair lift, possibly unfastening the seatbelt, and proceeded to climb the stairs. Jesus. So when she was unable to safely due to physical limitations and her underlying cognitive impairment, she has fallen on the stairs, falling downwards. Barbara had been found having fallen awkwardly, landing her trapped under the chair for the mechanically operated stair lift. Care staff were unable to free her because of the positioning and angle at which she was entrapped within the mechanics. So this is a very complex situation. On calling 999, it was obvious that neither of the care staff were sufficiently proficient in English to be able to explain clearly the nature of the medical emergency. And I'm sure some people are wondering where the nurse was because they are saying care. It could be that one was a nurse, but they are referring to them as carers because sometimes people do that. Or it could also be that it's one of those homes where it's assisted living and sometimes there are even no nurses whatsoever. And sometimes even a carer can be the manager. It's possible. So it can be that it's one of those as well. An internal audit by the ambulance service revealed that the call handler has selected an incorrect pathway. The correct pathway should have been selected was entrapment, but at no time during the call did the carer give any information that would have indicated that this person was presenting. This was the presenting problem. Okay, so the carer repeatedly used the word blocked, which added no assistance. Clarity of explanation of the events that were unfolding, So they did not understand the difference between bleeding and breathing. This made any meaningful triage of Barbara's condition virtually impossible. Okay, so the call handler followed the script to ask if the patient was conscious and breathing. That is, to ascertain clinical emergency and determination of priority response. This assessment was severely hampered given the carer did not appear to know or understand the difference between bleeding and breathing. And it was shocking that there was a Romanian who's from a European country but could not speak English. Honestly, I feel like sometimes if you're from the EU, if you're an European, do not come for me. But I feel like Africans speak better English than the other European countries. Honestly, my honest opinion. Okay. And they said the carers were also unable to understand the difference between alert and alive, which presented all of the same problems as referred above. So paramedics arrived on category 2 response, and on arrival, it was clear that Barbara was beyond medical help. She was pronounced deceased at the scene. The inquest concluded Mrs. Ramel had died of misadventure as a result of her fall, a combination of her dementia and frailty and mechanical obstruction of respiration. But Mrs. Marsh said she had been shown evidence that at least one of the carers' understanding of English did not meet the standards required to work in Britain. So apparently, Mrs. Marsh told the Home Office that Mrs. Watley that they have until the 22nd of January 2024 to respond to her concern. So she's actually giving the Home Office like a deadline, like respond to my query. In my opinion, action should be taken to prevent future deaths, and I believe your organization has the power to take such action. So a spokesperson for the care home said that they would like to express once again their deepest sympathy and that they're going to do better. All those things. So another thing that they discovered is that one of the carers did not have the required English language requirements. Okay, one of the carers on the evening of the 8th of August 2022 had never passed the SELT, which is the Secure English Language Test, so was not qualified or permitted to work in the UK. I think that's something that the EU people, an option that they can also take. So why was this person working? So guys, what do you think? Do you think this will have an impact on the English language requirements? And do you think that this can affect even nurses and carers altogether? What do you think is going to happen? Or what do you think? And have you had any such incidences in your workplace? Leave them in the comments below. But I'll leave the full story. It's quite long. I'll leave a link to the full story in the description so that you can read it for yourself. Thank you so much for listening and for watching. Bye.